Despite last week's announcement of a drawdown in federal immigration enforcement agents in Minnesota, tensions remain high in the Twin Cities.
Some communities say they've seen little change in the numbers of arrests or sightings of federal officers. And as special correspondent Fred DeSam Lazaro reports, the crackdown has impacted nearly every aspect of daily life, including many residents' health.
This is a new routine for Viviana Salazar.
I already have a system.
Filling boxes at a Minneapolis food pantry for families now too afraid to leave their homes. For weeks, networks of volunteers have sprung up across the Twin Cities to bring supplies to community members who fear that even venturing to a grocery store could lead to their arrest as part of the massive federal immigration crackdown known as Operation Metro Surge.
I received a message from a teacher saying my student had a glass of water for dinner. So that to me was heartbreaking.
When we met Salazar, she was delivering food to a 45-year-old father who's been in hiding for more than 2 months. He declined to be on camera, but spoke over the phone.
Day to day, what is the most difficult things that you have to deal with?
The most difficult thing is knowing what's happening and not being able to go out, locked in with fear that they come knock on your door. Because of the fear and the worry, I cry. It's the most heartbreaking thing to think about. If you leave, you might not be able to come back.
The fear that is forcing people to shut themselves in extends far beyond just grocery shopping. Children are not being sent to school. Adults are not going to work, complicating the challenge of paying the rent. And entire families are putting off going to the doctor.
I have type 2 diabetes and I have my pills, but they're about to run out. I have to go pick up more, but I'm afraid to go out.
For years, researchers have documented the possible health impacts of immigration enforcement, from worsening chronic conditions to poorer birth outcomes to heightened anxiety. The effects can be felt by both people targeted in the raids as well as their neighbors. At a press conference late last month, dozens of Minnesota doctors spoke about the challenge of providing health care in this moment.
I have been a practicing physician for more than 19 years here in Minnesota, and I have never seen this level of chaos and fear in the healthcare for patients and for our healthcare teams.
And it's not that people aren't sick.
Brian Fate is a pediatrician at Children's Minnesota. Emergency room visits at Children's are down almost 25%, but when patients do come in, they're often sicker. Admissions have jumped about a third.
I saw a girl who was about 5 years old last week. She had sat at home for essentially 7 days with a fever and an ear infection. Pain was keeping her up at night. By the time that she had presented to us, her eardrum had ruptured.
He's received accounts from colleagues that paint a similar picture.
There are cases of appendicitis that have showed up late. There are terrible asthma exacerbations that came in late as well, so that by the time you get there, the kid is really struggling to breathe. A 15-year-old with autism who came in with abdominal pain, and it turned out that his mother had been detained about a week earlier, so he had about 3 meals in 5 days.
With the number of families not coming in, Fate says the situation is eerily similar to the pandemic.
This is not a virus causing this. It is an action of the government which can be redacted. And I think there's a feeling of helplessness there too. We can do our best to try and reach out to families and to make things like telehealth more possible, but like vaccinations, kids are falling behind on their healthy checkups. When families don't feel safe leaving the house, when they have to balance the health of their child with the safety of their family, no family should have to make that decision.
Meanwhile, Fate says non-white hospital staff have even expressed fears driving to and from work. At other hospitals, there are reports of federal agents staying bedside with detainees and trying to question or arrest patients.
I'm a physician!
Bystanders also said officers prevented doctors from trying to treat Renee Good and Alex Pretty right after they were shot. The Department of Homeland Security told the NewsHour only that medics were, quote, on the scene at both shootings, but did not respond to other criticisms about how Operation Metro Surge has impacted healthcare. Across the Twin Cities, residents like Autumn Brown say the crackdown has strained their mental health.
I think most people's nervous systems are really jacked up right now. We're all living on high alert, and the human body can take a lot, but our bodies aren't designed to be on high alert for such a long stretch of time. It's absolutely wearing on me. It's wearing on all of us. The terror is real, and the care is real, and we feel that too every day.
One of the people trying to provide that care is Valerie Carrillo. She's a therapist at Canopy Mental Health and Consulting, which works with underserved populations in the Twin Cities.
Clients of immigrant descent are very hypervigilant right now and are taking a toll from everything that's happening and are on a daily stressed out. I've seen those clients physically in my sessions come in crying and shaking and going through the emotions of having like that safety kind of pulled underneath from them.
Carrillo, whose family is from Mexico, has carried her passport for months.
I think everyone in Minneapolis, including my clients, every single one of them are experiencing collective trauma, and I am too right there with them.
For Viviana Salazar, also a U.S. citizen of Mexican descent, these food deliveries are how she's coping with the realities of life in Minnesota right now.
Are you personally afraid yourself?
I am not afraid because I don't look Mexican. But my teenage daughter, she has dark skin, she has black hair. She has asked me, what am I going to do if they pull me over? Are they going to shoot me? And when she asked me that question, you know, my heart just broke. I can't believe we're living in this situation.
For the PBS NewsHour, I'm Fred DeSam Lazaro in Minneapolis.